Okay, it's live now. So, okay. Hello everyone. Today's Facebook Live is a little bit different from the usual Facebook Live that we have. Today I have with me Dr. Yu, sorry, and I want to introduce parents to Dr. Yu because I know him in my course of work, and I normally work with professionals that understand reflexes. So he will be a very good it will be a very good angle for parents to hear from what he has to say about oral development, questions pertaining to teething, latching, sleeping, feeding as well. I had a whole list of questions that I sent to Dr. Yu over this period because parents have been asking lots and lots of questions. So I picked up those that has repeated amount of parents asking. So I will give the show to Dr. Yu now. So would you like to introduce yourself to our parents?
Hello, everyone. Thank you, Eileen and Ling, for inviting me. Yes, I'm also very glad to be working with your team, right, to look into this whole developmental component of our life. I think this is also in conjunction with some of the movement that's actually happening internationally. Like, for example, France, they're committing some resources to look into the first 1,000 days of our life, right? So I think what is being neglected is really the very early phase. Why wait until to then change some things when you can actually make it right from the very beginning? So as a dentist, I am a general dentist. I'm doing general dentistry, but also I have a special interest into dental sleep medicine. I do craniofacial pain. But when I try to deal with this problem, I start to learn that the body is very complex, but also very integrated. And we do have our initial signaling, like just the moment we're born, right? I can't really see that well when I'm, a new baby. I can't move my body that well. I can't control it, I say. I can't control my bowels. But my mouth, right, has to be full function right at the very beginning. If I can't feed, I can't sense, right, the environment with my mouth, right, I can't survive. So that is how important the mouth is right at the very beginning, and it's really reflected by how much of the nervous system goes to the mouth. We talk about cranial nerve, for example, right? Or reflex. So how do we know how to control the jaw? How do we control the face to latch? How do we control the tongue? How do we alternate between breathing and swallowing, right? So they are all by reflexes, by cranial nerves control, right? So then we can properly feed and properly breathe, and the position of all this, shall I say, the function of all this depend on the position of the tongue. The tongue is very important in helping with the feeding as a very important organ. It controls the whole movement of the transfer of the milk. And also it opens and closes the valve when you swallow and when you breathe. So if the tongue is not in the right position, maybe what we noticed in my course of work, they do have a lot of regurgitation issue, for example. So when they're trying to feed, the milk gets in, they are trying to swallow, but they can't control well. Some of this is due to tongue tie. Then they have to hold their breath in order to finish the swallow. And if they're not swallowing fast enough, they're holding their breath for a longer time. After a while, they can't complete the swallow. They can't just say, I breathe first and I come back to swallow, because the passageway is now blocked by the liquid, the milk. So they have to regurgitate, vomit, right, in order to clear the path, catch their breath, and then they can go back to feed again. So it's very important that whole coordination, the transition, is well, well coordinated by the nervous system and the reflex system. So from there onwards, we start to realize that as we grow up, none of this is lesser in importance. Even when we're chewing, we need to coordinate the face, the jaw, the tongue, the neck, the swallow, and the breathing all at the same time while you're chewing, right? While you're feeding. So all that component is again the importance of the reflex system, right? Playing out together with what, of course, your somatic control. That means what you learn how to do it over a period of time experiences. And if we do it right, we train the tongue to go up, and we close our mouth, we breathe through our nose, and the function of swallowing, chewing, speech, all this is actually enhanced. But also we can train the other way. For example, if you put a pacifier in the mouth, and the pacifier takes the space of the tongue. The tongue cannot lift. After a while, the tongue learns to be low. There's a study from Stanford University, preterm babies, right, when they can't breastfeed because of they're still too small. They go into an ICU. They are given the milk bottle, and they have not changed the feeding method for 6 months. Just start from a bottle 6 months later. And what they realize, the jaw normal size become normal. The tongue become weakened, lower, and they develop snoring, right, after 6 months of bottle feeding in NICU. So if we don't understand that we can actually change the body reflex system and how we function, and we neglect the consequences, and we don't put into, let's say, into our conscious mind that when we open our mouth and breathe, we are actually harming ourselves, right? And we are pushing the tongue down. We are not allowing the tongue to coordinate the system again in breathing and swallowing, and affects our posture, affects our gastrointestinal system, affects our spinal system, the nervous system flow, blood flow, lymphatic flow. So that is how intricate the body is actually developing. And as we grow older, when the tongue is not in the roof of the mouth, it doesn't help the jaw to grow. Then what will happen is the upper jaw become very small and narrow. The teeth have no space, and then the bite can change. Then you end up with a malocclusion, right? And when the bite is narrow, the jaw is deep bite, there's no space for the tongue goes backwards to the throat. Yeah, then even children develop snoring. And from there on, right, it's not addressed. They can develop ADHD, right? They can develop behavioral issues, they have learning issues, they have difficulty in concentrating in class, right? They can't breathe well, they wet their bed, they wake up suddenly to scream and shout without even waking up fully. They just cry and go back to sleep, right? They have all kinds of issues that is related to breathing. So if we don't deal with it, we keep looking at other areas. Is it the aircon too cold? Is it because of the bed bugs, right? Because of allergies? Because of food, gluten? Yes, I'm not saying they don't contribute, but you don't address the very core issue of the airway is blocked because of the mouth breathing tendency, which is already known fact, right? That it is causing airway obstruction. And now in the latest journal of sleep medicine, which is a medical journal, they published that, adenoid tonsillectomy, which is removal of adenoids and the tonsil for those snoring children, 70% failure rate. Yeah, the recurrence is high. They snore again. And wearing the CPAP, the mouthpiece to breathe, is not a choice for the children because it flattens the face. It doesn't allow it to grow. So what is advised is actually for children to do, or parents to get them through jaw extension, get them to use oral devices, and get them to do myofunctional therapy. which is habit correction through exercises. So then the children can regain the ability to breathe well again, treating sleep apnea through dental approach, not just surgical, not just medical or pharmaceutical, should I say. Yeah. So it is the turning point now. I think the paper is published in February 2020, right? So we're learning more and more that the dental role is very important. More dentists should be trained in dental sleep medicine. And the trend has started. In 2018, American Dental Association started the training for pediatric airway health for the dentists in US, right, in 2018. So it's starting. It's just an infancy stage, I would say, early stage. But more and more dentists are now being requested to take on this and then observe this whole issue in children and identify it, manage it, if not refer, right, to either dentists who are dental sleep trained or ENT that's also aware of this aspect. Then it's a combination therapy in order to get these children healthy again by breathing well. So this is how as a dentist we are now in the midst of this whole thing. But as I say, all this is not given. Although yes, most of it is reflex system, but we can also mess it up. Yeah, so we have to identify what is a normal habit. Like for example, keeping the mouth closed, breathing slowly through the nose, deep, breathing deep, 6 breaths per minute, ideally, is better, is good, rather than allowing the mouth to open, allowing the tongue to drop, that cause the blockage, and then you see the head goes like that. Yeah, and then it affects the posture, and then it affects the whole growth and development. So it's very important as parents, especially, to identify this very simple to detect deviation. Mouth open, cannot have mouth opening. Yeah, it is related to airway obstruction, craniofacial, which is like the head and face, and dental growth, developmental deviation. And then I say when you can't breathe well, you can't sleep well, you can't perform well, and you can't grow well even, because the growth hormone is released. 75% of the amount is released from the pituitary gland, right, in the first 90 minutes of our sleep. We have to go into deep sleep before that happens, REM sleep. So if the sleep is disturbed, growth is also affected. Yeah, so this is also very important. So that's how I say it's very fortunate for us to make the link, yeah, and so that when Eileen and we see all these issues, and then for us, we can collaborate and then bring forth the awareness to the patients or the parents, right? So then the right amount of intervention in terms of early prevention methods into physiotherapy, through neurotherapy, through what we do is myofunctional therapy, to start the ball rolling into the correction stage, and then hopefully within a few years, things gets better.
Wow.
Yes, over to you, Eileen.
I really love listening to you. This is like my second time listening to you, and I always learn so much. I'm busy writing down, but then I think I need to pay attention and then watch the rewind.
Yep.
Yeah. So, I have actually a lot of questions, so I'm toggling between this computer and that computer. Okay.
No worries. I think let's take the time to explore this.
Okay.
Yes.
Why don't you you address one of the questions that I heard you mention? Does it mean that pacifier is not recommended?
If I'm not wrong, right, in US now there's a class action act against NUK pacifier, right now. Okay, so NUK actually is designed by a dentist, a German dentist, to have that shape of a compressed nipple. So supposedly, if you put the nipple mouth in, it doesn't create such a bad distortion of the jaw and the bite. Yeah, but the concept again is we just make space for the teeth, but we forget that we didn't make space for the tongue. So
Ah,
in the end, as long as your pacifier going there, it's just like, if you go into a room, there's a big balloon above you. You cannot stand straight. You always have to bend down.
yep.
Okay? Every time you enter the room, you have to bend down. Every time you enter the room, you have to bend down. After a while, I remove the balloon, you still bend down. You
Yeah.
don't, you think this is the highest spot already. Then that's why the tongue keep going low, and it creates issue for some people.
I,
If you think about it, when do we ever put a pacifier thing in the mouth? When do we start doing it? Last
when
20
they
years,
cry,
30 years?
when
Yeah,
they
one they
cry.
cry. But correct. But the truth is, right, when is this happening? Right? When is pacifier being used? It's like less than 60 years, less than 100 years, right?
Mm.
So I'm just saying, to the whole life span of our humanity, right? This is just a blip in terms of what we're trying to do. Breastfeeding has been the norm, right? For before World War II, right? Before
Yes.
World War II, nobody used the bottle to feed. Even immediately after World War II, nobody can afford formula milk. It's not that developed anymore. So only in the last maybe 20 years, 30 years, because of the industrialization, you know, more like say our female counterparts working, children have
Mm.
to be taken care of, right? Then I think that is a switch over, and of course, the formula milk company has done a fantastic job to convince the parents that your milk is not as good as their milk. Yeah.
Yeah.
So it's not about the milk. It's not about nutrition only. It's about the stimulation of growth. When you feed through the mouth, you activate all the muscles. Your jaw grow the fastest in your first year of life. Fastest. Because when you go through the birth canal, you cannot have big space.
Mm.
Everything narrow down, the skull can compress, so you can get out from the womb to the world. Once you get out, right, then you need to grow again. So the breastfeeding method is to stimulate the growth of the jaw. So if you give a bottle, you cannot give the same stimulation because milk, or should I say breastfeeding, is really hard work for the child. It's a lot of strength, a lot of coordination. But bottle feeding,
Yeah.
okay, like have you tried drinking water on your back? Can you swallow
Tough.
properly? Cannot, right? So
Tough.
why are
Yeah.
you teaching all our children to do it for 2 or 3 years of their life, and then expect them to be normal after that? Then they
Mm.
say, "Hey, girl, boy, why you swallow? Why you cannot swallow your food? Why your saliva keep drooling?" Because you can see a lot of children with a bit now, right? If we swallow correctly, our tongue goes up and go back, right?
Mm.
Okay, up and back. But if your tongue is low, mouth is open, they swallow, right?
Mm.
Yeah. So then drool lah. Then you wet a bit. The saliva keep pushing up because the swallow is wrong. But why they are doing this? Because when you lean back on the back to drink water, can you gulp? You cannot really know. So you have to learn how to slow down the flow. Then you have to do it
Mm.
with the bottle in the mouth. That's how we
Mm.
train them to be wrong, and then later all that become an issue. Yeah, on how they talk, how they swallow, how they how they breathe. Yeah. So you can see the impact. But unfortunately, we have no solution. After 4 months in Singapore, all the mothers must go back to work already. So what
Yep.
do we do after that? Yeah. So now we're not talking about a policy issue, all right? That one is another issue, right? I'm just talking about natural state. If we are no need to worry about anything else, right? We just have to take care of the child. Breastfeeding will go on and on until the child is ready to eat from his hand to mouth,
Mm.
right? And if he's eating with chewy food, hard food, it's going to work out. Everything is going to go. But now, right, we're a little bit too. Uh, we call it the princess issue. or everyone is a princess. So when they are ready to eat, we worry that they will choke, right? So we'll make very gooey stuff, baby food off a can, or you cook very good porridge, all the goodness. Then you blend, and then you feed them slurp, slurp. They don't have to chew. They just okay. And then you ask, why the jaw so small? You never use them. They don't even need to stand up, right? Like for example, to me, right? Don't ever put your baby in a walker, right? You should agree also, right?
We
They
don't,
need
we
to
don't
crawl.
encourage, yeah.
Exactly. They need to left, right, then the brain will develop. But you
Yeah.
put down a walker, they don't learn how to balance. They only have the leg dangling and then they did. It's like, you're training a paraplegic. What is going on, you know what I mean? And even like the truth is I make all this mistake 10, 15 years ago. I don't even know about it. And my child went bottle feeding and my child he didn't use the walker, but I will also swear off, we don't use pacifier, but we used to feed from a bottle. And I make them sit in this, this chair. I forgot what is it called already.
Bamboo
Where they
chair?
sit in. Okay, yeah, the bamboo chair. So they don't have to, they won't drop off, right? So again, they're supposed to sit and learn how to use their core muscle and balance system, right?
Yeah.
Then we put them on something that they don't even need to do anything anymore, just like, like in a cast. And then we later they cannot develop properly in motor skill. Then we ask, oh, what's wrong? We are the one to be blamed. We did it. We were the one who say we all that. And again, if you think about it, we should be up and about, walking around all the time, doing very manual work, doing all this, then our body develop. But now, if you ask, your child is sitting more than they stand or standing more than they sit.
Lying down more. They don't,
Lying down more.
some don't even do tummy time, which is a bit of a worrying for me.
Correct. So you see, the whole point is that they didn't even get their body to work out in a very normal, natural way to develop it so that coordinated of the whole senses, right, starts working out, and then the brain has to coordinate all that, right? So if we make it really convenient for them, right, or sometimes for ourselves, right, and then we don't want to suffer the consequences while we go for the convenience. It's impossible, right? There's no such thing. Yeah.
I always have this kind of issue when I meet new parents. They came in without understanding about oral development or feeding issue or speech development issue. So they just came in wanting to just have fun in the center. But when I look at the child, there were so many things that has gone wrong with the child, with certain way the mom handles the child. So that's why I always find it very important for you to come in and share with parents, because the explanation about oral development is far exceed what I understand about a holistic developed child, because what I do is more on movement. What I do is more on reflex integration. So that's why having you around to explain to parents, it becomes such a informative session for parents, and it's wonderful. So I'm very happy to speak with you today. It's so good. I think next time we should do more.
Thank you. Yeah, but I think it's just because I'm very curious. Yeah, because I have tongue tie myself. Right, I'm born with tongue tie. I cannot breastfeed. So my mom thinks that she drank some liver soup and she got no milk. It's not her fault. It's my fault. But actually, it's not my fault. So right, I didn't create myself. So and then with the tongue tie, I can't lift my tongue. My tongue always drop back. I grind my teeth a lot when young. Children, from primary school, I know. Secondary school, my friend don't want to share the tent with me because I make so much noise. In the army, they were looking for rats, making so much noise. It's me again. the whole night. So what is going on is because my tongue keep blocking my airway. I keep needing to tighten my jaw to push forward to catch my breath. So all this is now again also in the research published in the CHEST, which is a very prestigious journal for respiratory system. And then now it says sleep bruxism, clenching grinding, is into respiratory science. So when a child, low tongue, tongue tie, whatever reason the tongue is low, block the airway, not breathe, at night they have to push the jaw forward. Catch your breath. This is called RMMA, rhythmic respiratory muscle activity. 80% no sound, 20% kak. When it's it becomes sleep bruxism. So RMMA is medical, sleep bruxism is dental, but it's the same thing. Yeah. So it's a tongue-related issue. Child will have heart rate increase first, still cannot settle it. They become anxious, then they from deep sleep become light sleep. So they become light sleeper, a lot of movement. Keep playing like merry-go-round, kick everything off the bed. Then some even have to face down to sleep. They do tummy time at the wrong time because they cannot breathe. They have to face down to let the jaw and tongue drop down. Then they can sleep. Or they have to put a lot of pillow. Then they can prop the head up, right? Then they can sleep like almost half sitting. Or else they can't breathe because the tongue get blocking the airway. So if we can develop the tongue to rise up, it's just another muscle set in the body, right? If you can go to the gym and train your tummy to get 6 abs, you train your arm, you can train your tongue, you can train your lips, because all these are muscles. So by re-coordinating, you reopen the airway, breathe better, sleep better, grow better, learn better. Right? So all that is real, and it's all science. Right? So as a dentist, we are now in this whole area which is part of the craniofacial respiratory system. Right? So don't just look at dental. In Chinese, 有时候是叫做牙科, that is too narrow. 牙齿 only. Or in China, right, it's known as 口腔科. Right? So they talk about 口腔. Yeah, so 口腔 is much bigger already. Oral system.
Yep.
Yeah, which can include the back of the throat also, right? Yeah, so I think we need to sometimes even just the terminology, the name, right, will help you to open your mind or close your mind. Yeah. So if we don't venture out, again, as a dentist, it's not that all this is taught in my curriculum. No. Like I mentioned earlier, it's my problem. I want to seek help for my own problem. That's why I learn from many disciplines. And then I have a better understanding after I venture out and collect all the data and knowledge and integrate it. Then I start to understand how the body is working a little bit better. But it's still not enough. I still have to be a student. I cannot be a teacher yet. Yeah, I have to continue learning. Then there's a possibility of more discovery.
I'm also continuously learning. Today is a very lesson for me by listening to you. Okay, shall we go into questions?
Okay. Yeah.
Okay.
So maybe I say you prepare one of the list. Just go through the list first.
Yes.
First one, feeding related question. For example, the first one is my baby just started solid at 6 months. He tends to burp a lot and end up vomiting his food out. Is it normal? Right? Is it too early for him to start solid? So I think sometimes when we talk about solid, we're talking still slurp and it's not solid enough, right? Okay, the truth is they transit from drinking to eating. To me, again, is that have you trained the baby or your child well by sitting upright to swallow, or do you think they're leaning back to swallow? So as what we discussed earlier, if the tongue is not in the right position, they find it very difficult to transfer what I call the bolus, the mixture of food and saliva to the back of the throat. If they cannot lift it back up, they cannot activate the swallowing center at the back and activate the medulla. And then it starts the whole peristaltic movement going down. All right? You need the vagus nerve to actually coordinate between your breathing and your swallowing, and then at the same time your gut, right, also very much influenced by the parasympathetic system. So if the tongue doesn't go up there and start the main beat, then the lower bit, you need the main beat, okay, main beat, then main beat. So the main one is not proper and the swallow is wrong towards the front instead of towards back, then the swallowing control is not good. Then the contraction of the whole alimentary canal can be affected. Yeah. And then you can imagine, they're not going to take the food that well, burping, because of sometimes they just gulp air in there. And also they vomit because, again, it's down to swallowing. Can they swallow? Okay, you all try, huh? When you swallow, you cannot breathe. When you breathe, you cannot swallow.
I'm trying now.
Try. You can't do it separately.
I agree.
So, it's so simple, I think we don't really think about it, right? Okay. And when after you swallow, you will breathe out. You sure will breathe out. You won't breathe in. Okay? After you swallow, your airway get clean out. Psst, got one gas of air. Psst, clean it. So that you can breathe again. Okay? Very natural. So now imagine the child not being able to swallow properly. He's holding the swallow. You hold the swallow, try to swallow slowly.
I can't even swallow slowly.
Yeah. Because when you do that, you're holding your breath.
Yeah.
So if you hold your breath for too long, you cannot take it anymore. Which one do you choose? Continue swallowing or...
No, I choose to breathe.
Spit it out first. Let me just breathe. If they don't know how to spit, they just vomit it out first. Correct?
Yes.
Yeah, that's the reason.
I see.
So that's why you cannot handle it. As long the coordination between the swallow and the breathing is affected, prolonged, right, inefficient, right, because the tongue action is not good, right, you can expect this to be a problem.
Okay, this is such a common issue, even not 6 months, even when the child is older, such a common issue.
Yeah. So they cannot take the more fibrous food. They don't want to take chunky food, right? They don't want to take textured food just because they cannot handle, because the tongue is not properly trained, right, in the right way to lift the food towards the back of the throat. So they cannot swallow. Don't know how to swallow. Or else they try to lift cannot lift the tongue, they drop the head, so they swallow at it. The head go like. Yeah. So swallowing, you don't need to neck, you don't need your face to move, you don't need your shoulder to move. It's just plain tongue action in the back of the throat. Done. Right? Not like that. So some of them you can see the lip also move when they swallow, because the tongue pushed out, the saliva is coming out already. So they need to use the lips to push back. Because the action is wrong in the first place. You need the second one. But two wrong doesn't make it one right. Yeah. So we just have to retrain, and then it gets better from there.
Okay. So it is trainable.
Yes. It's just like, can you do a backflip now? Can you do a backflip?
Not now lah.
Not now, right? But if I make you train every day,
I can do somersault forward, but back, no.
no, it's okay. We can train you. Yeah. So if you can't do it now, we train, you'll be able to do backflip one day.
That's right.
It's just muscle. It's just muscle and coordination. That's all. Yeah.
That's right. Okay.
So second question, well, how can I encourage my baby to eat by themselves? She almost 11 months, feed by a spoon. She used to be fed by a spoon. She no biscuit in her mouth. When I give her vegetable or bread, she will play with them rather than putting them in her mouth. Okay. So again, right, when we use a spoon to feed, right, we also activate some reflexes. Facial. Okay. So you have rooting reflex, right? So when the nipple touches the face, the trigeminal nerve, the facial nerve sends signal to trigeminal nucleus, and the baby know how to turn. and orientate towards the source, right? How the baby know that you're on that side? The baby cannot see you. Baby can smell you, right? But it's just about the touch on the face.
Yeah, you
Then they
stroke.
know how to orientate and stroke. So now, when we feed them we're using a spoon, you know how confusing for the brain is. So when the spoon come in, okay, the tongue wants to lift, want to do it, but the spoon is going in. The baby doesn't control the spoon. The feeder controls the spoon. So the baby have to react to the spoon. Ah, okay. Then sometimes after the food gets around the face, you know what would they do? They will do this, scrape, and then feed again.
Oh, yeah.
So when you scrape, right, you know that also you're doing the rooting reflex to the face.
So they
Then they're
kept.
all like, yeah. Also, they don't know what the hell is going on. It's tough. So that's why hand to mouth is good, because they really grip. They go in. They know what they are doing. Everything is coordinated by themselves. They learn the actual, whether they're putting it right or they're putting it wrong. Or you know what I mean? And when they're chewing, and they know it's coming in, they can feel their finger touching their tongue and lips. They handle it themselves. Initial a bit confusing because there was some spoon thing in between. So once they are used to it, they could be very very well coordinated already. Okay. My 9-year-old boy chew one bite for almost 4 minutes under supervision. As he's eating alone, he takes 10 minutes to chew one. He just keep on chewing without taking the food at the back of his mouth and not swallowing. So again, this is what I explained. So if such a swallowing issue is happening, just see whether the tongue is low or not. How can you see the tongue is low? If you can see the tongue is low. If the mouth is closed, you cannot see the tongue is up. If the mouth is open, the tongue is never up. Nobody will open the mouth and put the tongue up. Like that. No one goes around like that. So the mouth is open, the tongue will drop. If you can see the tongue is low. So there is already a low tongue posture. That's why swallowing becomes very, very difficult. Because swallowing, you need to put tongue up. Suck, swallow, breathe, reflex, all depends on tongue up action. I did a TEDx talk on this subject. So you all can actually Google my name and TEDx Singapore, right? You'll be able to find my TEDx talk on this subject.
I heard it before.
Well,
It's good.
Thank you. So yeah, is this a component that we have to think about? Okay, so latching related question. Is it normal if my baby tends to latch messily? Okay, like very messy, milk leak out from his mouth? No, never normal. Okay, so again, latch, facial control. So touch nipple, baby turn, orientate, facial nerve action, how? Okay, so open the mouth, lower jaw, trigeminal nerve open, then you latch. Okay, upper seal by the upper lip, flanging, upper seal over the top of the breast, the lower jaw open, then seal up the bottom of the breast. So you form a good seal around. So a deep latch is good. When you can achieve a deep latch, the nipple should be in the soft palate area and not in the hard palate area. Yeah. Then when the tongue lifts up, the tongue can get the rhythmic action and then starts the whole transfer. But if there's a tongue tie, the tongue cannot lift and the baby cannot open the mouth, sometimes also because of the lip tie, the nipple cannot go as deep down, right? Then the latch is open up because the seal is not good. Then you get milk leaking out. And while they're feeding, they will end up swallowing a lot of air as well. So it's called aerophagia. Simply put, eating air. And then they'll get a lot of air into the tummy when they're air go in here, so milk leak out. Air go in, milk leak out. Okay? They feed slowly, extended feed, prolonged feed, because every suck is not efficient at all. right? And then they end up drinking a lot of this, they get bloated up. Sometimes the air gets so high in pressure by sucking, then they get this thing called AIR. Yeah, it's called aerophagia induced reflux. Then they will have too much, and then they go bloop, bloop, and then all the milk comes out. Or some of them already have the reflux issue, also swallow, they cannot pick a tongue up, right? The milk is there, they cannot, also they will burp, and then they'll regurge, reflux first, then they go back and feed again. And sometimes the feed is so long, they're so tired, they fall asleep. Then they're not fed fully, but they're tired already. And or sometimes because of this, when there's a tongue tie, when they try to lift the tongue, they also pull the lower jaw. The thing is holding on, right? So when they lift the tongue, the lower jaw get pulled up together. So what happened? The lower jaw is nibbling on the mom's breast, and it can be very painful for some of the mothers, to the extent of even bleeding or even nipple damage. So if there is a certain issue like this, please go and see a lactation consultant, right? And they will be able to give you some advice. Not all of them understand tongue ties, and also you have to see your relevant doctors. Not all of them understand tongue ties, so it's a difficult thing, yeah, because the whole world don't think a tongue tie is a problem. So it will take some time before it become properly documented, and then we have a chance. The problem is milk formula company will pay a lot of money to tell and market the water feeding is good or milk formula is good. They will not pay that kind of money, right, of their $70 billion industry to tell mothers that breastfeeding is natural, is the best, right, and it should be the only way, right? It's against their commercial. Anyway, that's another topic altogether. That's why in 2018, when UN passed a resolution to promote more breastfeeding around the world, US stand up to veto against it and threaten other countries with trade war if they sign a treaty. Yeah, to protect the $70 billion industry. You can type in
for the child's development, really detrimental to child's development.
Watching the American CDC and also how Trump managed the COVID situation in US, you can understand. Also hearing what WHO is talking sometimes, right? The flipping of the wear mask, don't wear mask issue. You can also understand people that you think has an idea on how to organize all this. They might not be really that clear what is the right thing after all. And if they have their own agenda, unfortunately, the interest of the people is not taken care of. Okay, my child is 15 months old, haven't slept through the night. Have countless wake time and tried training but not work. Okay, so same thing for a child, a baby. If the tongue is always low, let's say you bottle feed, tongue is low. So they always open the mouth and they drew a little. Their tongue is not up. At night when they sleep, now that they're on their back, what happened to the tongue? The tongue will fall back and block the airway. Then the baby, right, cannot breathe. It's not the baby that's hungry. The baby is not wet. The baby cannot breathe. And breastfeeding is the best way to prevent sudden infant death syndrome by training the tongue to lift. But if we use other things, we push the tongue down, it can actually increase the risk. But one of the reasons why they can't sleep is they can't breathe when they sleep. So they tend to be very fidgety and they'll cry out for help. They want you to carry, and if you carry them over the shoulder, right, or carrying them with the football hole, they're face down, or they're lying on your chest face down, they sleep better. Or when you carry them and walk around upright in a baby carrier or you're holding them, they sleep better. Because when they're upright, they can breathe. That's why they can sleep. But when they're on their back, the tongue will block the airway, they cannot sleep. So against the research from Stanford University by Professor Christian Gumino and his team highlighted short lingual frenum is one of the reasons why they have pediatric sleep apnea. Yeah. So if the tongue doesn't lift because of the restriction, it can cause sleep apnea in children, in babies.
Dr. Yu, can I interrupt? There are some questions on the internet.
Okay.
Can I read out to you?
Okay.
My daughter has swollen tonsils, like kissing tonsils. Is the recurrence is high, and what can I do?
Okay. This is a very big issue now, in the sense that now the question is, the tonsils are never born big, right? They're never big when we first come to the world. How come they end up bigger? And they grow until it becomes kissing, meaning there is hardly any space between them. It's going to obstruct the airflow. So if there's any kissing tonsils, this is great. It's considered a severe grade. I would strongly recommend you to see the ENT to address it, because it will now jeopardize the breathing. But if the tonsils are not as big as kissing, they're not touching yet, there's always opportunity to change the habit through breathing and try to reduce down the need for this inflammation state. Because tonsils are all housing the fan cells, this ring called the radar duct around your neck. So if you breathe through your mouth all the time, you will induce them to be much bigger. So you breathe through the nose, your nose will clear the air, filter the air, warm the air, humidify the air before it enters the lung. And also the nitric oxide from your nose produced in your sinus lining will help to disinfect the nose. So all this will help. So changing the habit is still going to be helpful. But if it's kissing tonsil, please see your ENT. I recommend Dr. Jeev from Mount E in Novena, and he can help you to address your child's situation. And sometimes, no choice, you do a surgery. But after the surgery or before the surgery, you must start myofunctional training, meaning you must rehabilitate. Because again, another research by Stanford University, after the surgery is done, the child do not do any habit correction. It will recur. It will still snore and don't sleep well because the habit has not changed. Yeah, so after 2 years of muscle training, right, the child regain a better breathing technique. Then this avoid other inflammation issues.
Another question. I have 3 kids and I'm doing academic work with my boy and daughter under ATM, but is suspected. At the moment, but is suspected HFASD, high functioning ASD. Child is allowed to do craft in the room. She doesn't like to sit in her room. Instead, she plays when we are visible. Am I okay? I'm okay with this as long as I don't disturb. She makes vocal sounds every 2 to 8 minutes. She gets the boys' attention for reward, verbal praise, and sending her to her room, and also ignoring but doesn't stop. Sorry, because the way parents phrase the question, I'm not so sure, but I guess she is asking for the vocal noises to get attention.
Okay. Is some parts are really beyond my scope. I cannot understand some of this problem. I'm not well in that. But just to share, some individual do have tics or called Tourette's. And again, we have treated, or should I say, we have helped some patient with this kind of functional issues by regaining the tongue function. So when the tongue is down, again, it's down to the cranial nerve. So when the tongue is down, blocking the airway, right, she's always Even some of them, right? If you see when they swallow, their eyes do this. Their eyes blink a lot. Yeah, it's also the tongue is not up and they're not slowing down their breathing enough. So you can just test by looking at them, concentrate, mindfulness, all right? Ask them to put their tongue up gently, okay? Then breathe slowly. Then you notice the blinking either lesser or stop altogether. Because once the tongue hypoglossal nerve is in place, the accessory nerve is in place, right? It also helps with the facial nerve not having to fire more. So all I can say, not specific, is there are cranial nerve issues. If you can coordinate them, maybe some of the things that she highlighted might be better. Yeah.
Okay. So we go back to the list of questions while I wait for new questions to come in.
Okay. My child is 10 months old and no sign of teething. When should the baby teeth or be teething? Well, general rule, 6 months. We have some even having teeth in early as 2 months. My boy first tooth came out at about 9 months, right? So the plus minus quite a fair bit of months, right, in terms of the eruption. So I don't think you need to be too concerned if it's just around 10 months, right? As long as they're there, they will find their way through, right? Again, I feel if there's stimulation, good amount of activation of the jaw situation, right, it might promote the eruption. Drooling related question. My baby doesn't drool when teething. Is it normal? As I see a lot of baby drool when they're teething. Does baby drool stops after teething? I'm not quite sure about that part on teething. You have to drool, right? Obviously there is something in the mouth now coming out, and when we start to move our tongue and move our lip, right, it is activity, and that can actually stimulate your salivary gland and give you more saliva. But probably not is automatically when the teeth is coming through, they will have more saliva. So yeah, not necessarily the case. Don't have to be too concerned. My child is almost 6 years old this year. When he's playing, he opens his mouth and sometimes he drools without realizing it. I constantly remind him to close his mouth as he's entering P1 next year. How do I be with him? Be that okay? How to be give him constant reminder why he cannot close his mouth. So again, when they open their mouth, they use their nose to breathe. Sorry, when they open their mouth, they use their mouth to breathe. The tongue is down. So when the swallowing, as I explained so much just now, is pushing forward, that's why he drools. If he closes his mouth, the tongue goes up, he swallow pushing towards the back, the drooling will stop. And if he is always using his mouth to breathe, his nose gets blocked because mucus is always produced all the time to filter the air, warm the air, humidify the air, and slow down the air. But if you use your mouth to breathe, the mucus doesn't get cleared. Every breath you take, clear your mucus. Every breath you take, you clear the mucus. How many times do you breathe through your nose a day? Don't count.
I don't even know. It's just so normal.
That's the problem with us, right? Because if I give you 20,000 breaths a day, each breath becomes worthless. But only if I give you one more breath, and that's it. You know that if you don't, after that breath, you don't have no more, it's really scary, right? If it's down to your last breath. Every breath is important, right? It is. No one, you miss a single breath, you're dead. But because I give you a lot, you assume that you always get enough. But the truth is not the case. Yeah, so I suggest you can Google, watch YouTube about deep diving, or should I say free diving. One breath and go into the water, 100 meter down, and then up again. One breath. So the free diver, longest hold is 22 minutes, 22 seconds. One breath.
That is very,
You
very long.
you cannot lose your focus about the movement. After you go down, you still only have that one breath. You still need to come up later. If you go anxious, you think about your next breath, when is it? Then you don't coordinate your movement, you're literally dead inside the water. Somebody had to pull you up already. And if they pull you too fast, you get your bends, right? Nitrogen get into your blood, you'll also be in trouble. So you go in, you have to control your mind to be so free, so quiet. If we can use every single breath like that, we'll be healthy. But we talk too much. Every time we talk, we swallow breath through our mouth. Because if I talk and breathe through my nose, then I talk again, and then you don't have to listen to my talk anymore already because it's too destructive. We just talk, I suck. And even you do a lot of swimming, you learn how to mouth breathe, is not too good. So we don't know how to take it slow anymore. By giving us enough of our own time to breathe through our nose, 6 breaths per minute is the best. Then you coordinate your heart rate down slowly, your blood pressure drops, your whole body calms down. 6 breaths per minute. So when the child is mouth breathing, the nose gets blocked. Then until you train him to use his nose again, it's very difficult for him to close his mouth because he learned how to use his mouth to breathe already. But it's not good because he will dry up his teeth, dry up his mouth. So a lot of gum redness, a lot of things stuck on the front teeth. Yeah, breath. Like, don't swallow well, Drew. Don't chew well, don't swallow well when eating food. Posture is bad. Don't sleep well. Right? Don't sleep well, don't concentrate well in class, don't rest well, behavior, very mangzang, very agitated. Yeah, so all this kind of thing is from not being calm. So you think about it again, all right? You imagine a cave. Outside the cave, you have to hunt, but you also can be hunted. So you're very anxious, anxiety is high, so sympathetic tone is very high. Right? When you go back to your cave, you're safe. Parasympathetic tone higher. And when you're safe, reproductive system, immune system, digestive system, all depend on your parasympathetic system. Okay? So when you cannot breathe well, will you be calm or anxious?
I'll be very scared, lor. It's like I cannot even catch my own breath.
That's right. So when every breath is not ideal, you'll be always a little bit anxious. So the anxious state, even though you don't perceive it, it is there already. Your sympathetic tone is high, your heart rate is higher, right? Your blood pressure is higher. All that is to create a mental stress because it's not really your stress, but it's your oxidative stress. You don't get enough oxygen. And that put you in a stress mode and you can't be calm. And when you cannot be calm, then your reproductive system, your digestive system, your immune system cannot be good.
Yeah.
Then
like,
you get
I have to wear face mask. I always feel I cannot breathe.
So for me, because as a dentist, I got to wear mask every day for the last 20 years. A lot of training. It's not easy for us also, but the truth is you just have to use your nose to breathe and really breathe slowly. Take your time. Find time for yourself. So mindfulness, all this yoga training, qi gong, all tongue up, breathe slowly, breathe through nose, calm your brain down, get your body healthier. Just that. Give yourself enough oxygen, you'll be fine. You don't have so much supplements and all this. Yeah, just fill yourself with enough oxygen.
Okay. Now
Yep.
I toggle back to this computer, and this computer also have a few questions. Okay, so I'm
Okay.
going to shoot. All right. So first question is I have 1-year-old baby. She always put everything into the mouth, even when she's not hungry. Is it okay?
Again, that one is a little bit out of my scope, but I can only just
Answer? Can I
yes,
answer?
yes, yes, please, please,
Because this one
please.
is
Go ahead.
our development one. So children explore with their mouth, with their hands, and the first thing they explore is with their mouth. That's why they like to put things in their mouth, put hands in their mouth. So it's normal. Mommy, you're doing it well. Do not stop that from happening.
Okay, so I can share one part is that our somatosensory cortex, right? The part on the brain that actually takes sensory, the largest real estate is given to your mouth area, then your fingertips.
Yeah.
So your mouth is more sensitive. So one little grain of sand, one strand of hair feels so big inside your mouth because your mouth is your defense system, right? You need to feed, you need to do. So we learn sometimes to actually detect. And I mentioned earlier, when you're born, right, everything else not functioning well, your mouth is already full steam ahead because you
Mm.
need to feed or else you're eliminated. So the mouth is very important. Day one till day end. Very last day of your life, you still depend on your mouth, like the first day. So it is so important because of the neurological innovation that almost involve all your cranial nerves, right?
Okay. Second question. Is there a reason why some people struggle with swallowing pills and capsule? I always choke on tablets and capsule until the water go back into the nose, and I sometimes feel that the tablet is trying not to go down the windpipe.
Yeah. So again, it's the control of the bolus, we call it. Yeah, the tongue has to lift and stop against the back of the throat first. He has to be doing that. Then there will be a contraction backwards and dump the whole thing backwards. So if you're unable to lift the tongue to that position to start the medulla in conceiving that whole action, right? Then your F pipe epiglottis is not closed. Your pharyngeal muscles are also not tightened up enough in order for you to coordinate that whole process of pushing back. Obviously, you can get into a very messy situation in there. So yes, by coordinating your tongue up, swallowing slowly, your saliva, you practice a few more times. Take a small sip of water, put it to the roof of the mouth, hold it there, and swallow without pushing the tongue forward. Only push the tongue back. Or you don't even push the tongue back. Your tongue still hold position. It's just it contracts backward. Take a small sip of water, put it up again, contract backward. Yeah. So by training that, next time you have no more problem swallowing your pills already. But
Okay.
exercise is one thing. You don't change your habit. The next thing you go and open your mouth again, like your tongue always low. Yeah. 前功尽弃. Yeah.
Yeah, I agree. Yeah, same as what we do in our center. Must practice. Repetition is the key.
Yeah. So you have a habit. You cannot forget the habit, but you have to form a new habit to override it. So that's how it actually works.
Okay, one more question that I saw that just came in. Should parents try to stop their kids from tongue or finger sucking? My own child were breastfed and they were efficient eater. One started to suck their finger, middle and ring finger from 4 days old. She stopped at about 3 years old. I'm just curious about this part.
So basically, we do our self-soothing. We calm ourselves down, right? and that is to activate your vagus nerve and your parasympathetic system. Best way to do it is to put your tongue up, swallow. Okay, so in some situations, you see people are like, they're very scared, very scared. People say, okay, calm down, slow down your breathing. Okay, swallow saliva, or you give them a cup of water to drink. Okay, so by drinking and swallowing, you're activating your parasympathetic to calm your body down. Some people, when they give lecture, they get very anxious. Then they go, So by just doing the also activating that system to calm yourself down. Some people, they go into chant. No. So again, when you activate that a lot, you go into a trance state, which is very calming. So that whole back activation is very important to calm. We need to calm down because we are very active as a mammal. If we always very active, now of course you run out, you get tired, get hungry, you can call grab food, food will come to you, right? Last time, as a mammal, if you activate yourself so much, you cannot calm down, you run out of energy, you die because you cannot find food. So vagus nerve activation called the vagal tone is very important. And also it stimulates everything else that's helpful for our health. Now, if your tongue go up and activate this every swallow, 2,000 times to 2,500 times a day, when your tongue is up, when you breathe, 20,000 times a day. When you're resting, your tongue is up. When you swallow, you breathe. When you rest, when you move, your tongue is up. You are always kept into that calm state. So when you're not calm, sometimes you put something in there to activate. It's called non-nutritive sucking, right? You might be activating that calming event. So if you put finger in and this one touch the roof of the mouth, then it's very calming. Then you get addicted to the calming state. But it's not meant to be done by the finger, it's meant to be done by the tongue. So if you can get the tongue to do the job, the hand can rest. The finger can rest. Yeah. It's necessary to be activated, but it's not it's just the wrong tool to use.
Yeah. Okay. All right. So we have managed to answer most of the questions. I think today is a great session. I personally think I learned so much, and I'm very, very thankful. I think we can have more of such sessions in future. I think.
Yeah, we can definitely.
It's going to be very good for parents. Yes.
Yeah, I think this is one area that is actually missed out in our health management. Yeah, and I think as parents, don't just look at your child, look at the person in the mirror as well. Yeah, so many of these issues when we discuss is not a child problem, it's a human problem at all ages. So even adult and older people can suffer from dysphagia, difficulty in swallowing, right? And they get older, the tongue strength, if they, and the swallow component, if the tongue is not strong enough, they have issues. So in Japan, they even have program to help all these older people to train the tongue so that they can swallow properly. So I think in our growing population, also look at your parents, look at sometimes even ourselves. Are we swallowing correctly, right? So this is all key component, and the tongue plays a very important part. Like, I think Eileen can share the link of my TED Talk, right?
Yeah,
I think it will be helpful.
I will.
Then you can just share it because this is all being discussed as well.
Yeah. Okay, I will share that. And then very thank you. Really appreciate your time tonight. You are such a busy man, but you are so willing to come out and share with all the parents. And then I tell you, I'm going to share on some of the Facebook pages that I follow. I think it will benefit so many parents not only in Singapore but worldwide also, because I do have groups of parents who are focused on reflux issues and focus on feeding issues. So you'll be very famous now.
Thank you very much for helping with this spread of the ideas. Yeah, and like I say, we are all still learning. This is what I gather up to this point. More need to be like say learned, and then the more we share, I think we also understand that there will be more that we need to actually learn as well. Also, okay. Thank you very much, Eileen, for having me.
Yes,
Yep.
we will arrange for another session, because I see questions coming in towards the last few minutes. But I think we will stop here. We will answer this next time so that people are looking forward to next session.
Okay. All right. Well, then we'll do another one then. All right.
Okay.
Thank you, everyone. Good night.
Bye.
Bye. Bye. Bye.